abnormal protrusion of a viscous or a part of viscous through an abnormal defect in the wall of the cavity it contains. Suppose करो ये एक sac है, this is इसको आप एक बोरी से कवर कर लो, this is a sac, ठीक है? तो इसके अंदर कोई चीज मैं डाल दूंगा ना, कंटेंट्स इसमें डाल दूंगा, ठीक है? तो वो क्या बन जाएगा? वो नॉर्मल हर्निया सैक है, ठीक है? बट इन स्लाइडिंग हर्निया वन ऑफ द कंपोनेंट ऑफ द वॉल is a viscera. Viscera is the part of viscera is forming sac. This is sliding hernia. Simple. ठीक है? One of the viscera is forming. Right side पे cecum, bladder, ठीक है? और colon left side पे बस colon भी आ सकती है, लेकिन ये this is the cecum और sigmoid colon, ठीक है? और bladder. These are the most common.
तो फिर इसका रिपेयर कैसे करते हैं?
रिपेयर थोड़ा डिफिकल्ट होता है, इसमें आप फिर उसको मोबिलाइज करते हैं और एक वन साइड से ऐड करते हैं, वो सेक्शन इज टू बी वेरी केयरफुल. देयर आर चांसेस ऑफ iatrogenic proliferation of viscera while opening up the sac, so it's very essential to dissect the sac completely, and it should not be transliterated blindly. There should not be blind transliteration of the sac. Difference between epigastric and paramycal or umbilical hernia. If it is above the umbilical region, if it is above, even आप एक वस्तु लैंडमार्क बना लें कि 2-3 सेंटीमीटर above होता है, तो then that is epigastric hernia. You find some difference of 2 to 3 centimeter that is above. If it is not present in the umbilical region, that is epigastric. If it is on upper side, that is epigastric. If it is on lower side, it is hypogastric hernia. At some time, we used to say paramycal hernia. Now, as per your standard books, it has been classified as adult umbilical hernia or childhood umbilical hernia. ठीक है? Childhood या infant umbilical hernia or adult umbilical hernia. So you can say paramycal hernia as adult umbilical hernia. Even paramycal hernia is even fine, but it's better term. ठीक है? तो difference क्या होता है दोनों में? कि एनाटॉमिकल डिफरेंस क्या होता है? व्हाट इज एनाटॉमिकल डिफरेंस? सैक. द चाइल्डहुड umbilical hernia that directly arises from sac. Its sac itself is the hernia, right? जैसे कि for example, if through umbilicus if this appears through umbilical, this glass, this is sac, we take it as a sac. ठीक है? So there are umbilical pedicles around like this. This is umbilicus, right? ठीक है? और if that arises parallel to it, it is adult umbilical hernia or paramycal hernia. ठीक है? Umbilicus with its pedicle is present along with sac. Umbilicus and the sac. A sac and umbilicus is present parallel to each other. This is adult umbilical hernia. In infant, there is the sac, this cord, this gets separated. It's a part of the sac, right? So it directly arises from sac. समझ आ गई? आपने ये बताना है for your convenience. Childhood umbilical hernia, it directly arises from sac. It is made of sac. और adult में क्या होता है कि this is parallel to umbilicus. Sac is parallel to umbilicus. Adult में क्या होता है कि the umbilicus is slit shape. It is slit like umbilicus. और childhood में crescent shape, slit shape, ठीक है? और childhood में directly bulge कर रही है, ठीक है? There is no slit, it's directly bulging up. ठीक है? In childhood you can wait and you can manage the patient by observation, and usually it regress by the age of 6 months to 18 months. It usually regresses. It's not valid for inguinal hernia. Inguinal hernia does not regress, right? But paramycal hernia, there are chances that it can regress. Because you do not have to repair it. अब आप बच्चों में अगर आपका जो MCQ आता है या आपका कोई भी क्वेश्चन आता है तो उसमें आपने ऑब्जर्वेशन लिखना है. First thing is observation. You should not go straight forward to the age देखनी है 2 years up to 2 years or 18 months to 2 years. You just have to write down as observation. और adult में आपने जो है if the defect is less than 2 centimeter, we can do Meo's repair. And if it is even less than 1.5 centimeter, we can just do anatomical repair. Just simply just place 2 stitches, anatomical repair or Meo's repair, and gold standard is herniaplasty. Place a mesh over it and repair herniaplasty. There are 3 different layers: inlay, onlay, or sublay. Onlay, we just place it directly over the rectus sheet. That will be muscle और sheet के दरमियान होगी sublay, और inlay हो जाएगी inside. Pre-peritoneal. That will be inlay. इसको composite mesh से कहते हैं. It has 2 surfaces. One is hydrophobic and the one is hydrophilic. So the gut does not adhere to the. Okay, so that mesh is called IPOM. Right? Complications आपको पता ही है. Seroma is the most common complication. Hematoma, scrotal hematoma is most common. Wound site infection, अगर आपसे complication पूछने जाने हैं. और उसके बाद क्या कहते हैं, stick sinus बन सकता है, mesh rejection बन सकती है complication. ठीक है, ये हो सकती है. तो आपको 2-3 recurrence is the complication. ठीक है, what is the recurrence rate? 2%, 2 to 4% तक लोगों ने क्लेम किया हुआ है इसके साथ, mesh के साथ. ठीक है, so recurrence is a late complication. Pain, if some nerve is involved, pain. ठीक है, इसको कहते हैं inguinal-diarrhea. क्या कहते हैं? Inguinal-diarrhea. ठीक है, if the nerve is stretched or there is neuroma formation, then inguinal-diarrhea can happen. आपने ये पूछते हैं कि एक तो आपने social history, socio-economic history important है. वो long case में है socio-economic history, because what kind of repair can you offer? ठीक है, it can be laparoscopic repair, it can be open herniaplasty. ठीक है, what is socio-economic status is very important for that. ठीक है, so that is important. और आपने क्या पूछना है? Cough case की, chronic cough, smoker, chronic cough. ठीक है, prostate. In young adults, you will ask about stricture urethra, any difficulty or congenital anomalies about urination, and old age about prostate, bladder outflow obstruction in both cases, right? Chronic constipation. ठीक है, if the patients remain chronically constipated, then there can be chances of recurrence or hernia formation. Okay, what else?
Occupation को भी पूछेंगे.
Occupation is socio-economic. Occupation.
Yeah.
Laparoscopically, we perform 2 kind of repair. One is the transabdominal pre-peritoneal repair, TAP, and the other one is total extraperitoneal. It is TAP. और laparoscopic और open hernia में क्या difference होता है? What difference of pain? ठीक है, recurrence rate is almost similar. Pain. Inguinal hernia, if we repair it with the laparoscopically, pain is significantly less as compared to open hernia.